Welcome to Disability Law for Railroad Workers.
Hey everybody, welcome back to an all-new episode of Disability Law for Railroad Workers with Roger M. Driskill. I'm your host, Mike Leon. Roger here is a disability attorney who helps people secure the benefits and steady income that they deserve, including railroad workers, Social Security applicants, ERISA claimants, and federal employees. And in today's episode, we're going to be talking about why your doctor's documentation matters so much in a railroad disability claim. Roger, good to see you as always. Let me ask you at the top here, why is treating the doctor's opinion so important to the Railroad Retirement Board? And why is it crucial for that opinion specifically to explain how the worker's conditions affect their job?
Thank you. The Railroad Retirement Board requires medical proof that a person is disabled and qualifies for benefits. Railroad Retirement Board worker can look at a medical treatment note that says Jim came in today and reported fatigue, or Susan came in today and reported neck pain, or Jerry came in today and reported anxiety. Having those isolated words in a treatment note or a medical chart is good, but the treating physician or a specialist has medical authority and medical credibility to give an opinion that the totality of the evidence of the medical record of this applicant supports disabling conditions. Remember, the issue is, can this railroad worker perform his or her own occupation, or can this railroad worker perform another occupation, depending on the burden of proof? And so the Railroad Retirement Board is looking for medical evidence to answer that question. Having a medical specialist, which is a doctor, provide an opinion supported by medical records, treatment notes, tests, and other documents in the medical record of the applicant is critical, because that provides an answer to support a decision awarding benefits.
You know, in the previous episode, you were talking about the doctor's report and what it should include. You touched on it a little bit there. I would love for you to elaborate a little bit more. There's obviously medical records, there's test results, but what else is there that needs to be included to really show that the worker is limited in doing their job?
It's critical that the railroad worker be in medical treatment. It is common for people to get discouraged. They believe that their conditions are not going to get better, so they could go into the doctor, or this pill is not working, or this physical therapy effort did not work, and so I'm going to give up, or I'm not going to take the medicine like I'm supposed to. So it's critical that the worker do what the doctor says and be in proper medical treatment. So if a doctor has the records in front of him or her showing the medical history of the applicant, showing what's worked or has not worked as far as medical treatment that has kept this worker from getting better, then the physician has a basis to give an opinion. In the medical opinion, ideally, the doctor can say, I have reviewed records from this hospital, that clinic, this physical therapy facility, and any other place that's provided medical treatment. It is my opinion that Jim has these medical conditions, list all the diagnosed medical conditions. The diagnosis of the medical conditions then need to be supported by references to the medical record. If Jim has bipolar disorder, and the doctor giving the opinion can say, I've looked at the records from this hospital, or I've looked at the records from this psychiatrist, and there's 15 treatment notes regarding bipolar disorder, then a medical opinion saying this person has bipolar disorder with all the symptoms that are in the record make it possible for a medical doctor to give a well-supported opinion. So the well-supported opinion needs to have the diagnoses. It needs to have references to medical records that support the diagnoses. And then it also needs to have a list of symptoms that are in the record: fatigue, back pain, numbness and tingling in the hands or the arms, bad concentration, bad memory, anxiety. And then on top of that, daily activities. Jim reports that he needs to take a nap every afternoon because of his fatigue. Or Susan reports that she can't get along with her family members because of her anxiety and depression. So, references to the severe medical conditions, references to the medical treatment records to support the severe medical conditions, the symptoms that are in the record, and unsuccessful medical treatment are a terrific package for a good narrative that can be very helpful in supporting finding that this worker is disabled. If a treating physician or a specialist refuses or declines to give a well supported letter, it is still possible to assemble the medical records, again, including all the severe and medical conditions, pointing out the symptoms that are in the record, pointing out the unsuccessful medical attempts, such as bad medicine or side effects of medicine, and report of the inability to sustain a physical activity for an 8-hour work period on a consistent basis. It can still be done without a doctor's opinion, but the medical doctor who's an authority is ideal.
Roger, we all make mistakes as human beings. What are some mistakes that you've seen potentially doctors make when filing out some of this paperwork? And how can the worker get ahead of that and prevent those errors?
It's critical to remember doctors, nurses, healthcare providers are there to make the patient better. Many clinics and hospitals call the medical records progress notes. I've noticed a trend in the last few years. Hospitals and medical systems are putting the word health into the name of their clinic or their hospital. So people go to medical school, people become nurses, people become therapists because they want people to improve. So many physicians refuse or do not want to help a person get a check because that's not their job. Many doctors take the position, I'm here to help this person get better. I'm not here to help this person get a check or help some lawyer that means nothing to me. So what the patient can do is stay in treatment and truthfully report your symptoms. I'll give you a classic example. Every time you go into the doctor's office, invariably the medical assistant or the nurse will say, "How are you today, Jim?" It's almost human nature to say, "I'm okay" or "fine." As soon as you say, "I'm okay" or "fine," that is going to go into your chart. And if you have said, "I'm okay" or "fine" 8 or 10 times in your medical record, it's hard later to say, "I'm not okay" or "I'm not fine." So when a person goes into the hospital or the clinic or sees a therapist, tell the truth. My neck hurts. My hands are tingling. I have fatigue. Whatever your symptoms are, tell the truth. Yes, you may have told the doctor 2 months ago you have fatigue. That doctor doesn't remember that, or that nurse doesn't remember that. Every time you go in, repeat your symptoms. Don't assume that because you told the nurse 2 months ago that you have neck pain, that that nurse remembers that you have neck pain. Don't assume that that person has total memory recall of your chart. So stay in treatment, tell the truth. You're not Superman anymore. Admit I have these health problems and they need to be in my record. And you need to be consistent in your treatment. If you miss appointments or don't take your medicine, the doctors are not going to be as happy about that and not be as favorable about helping you if you're not cooperating.
Agree on that. Roger, can you share or can you think of an example right now where the strong documentation from that physician turned in a denial that was originally denied to that worker into an approval?
Yes, if a person is denied, it's not too late to fix the claim. It's very common for a railroad worker to come to me after denial and need help. At that point, I make sure that the Railroad Retirement Board has all the records. I find out what sort of relationship that railroad worker has with a primary care physician or a specialist. If there is a good relationship and if the physician or specialist is supportive, I ask if it's okay if I reach out to the doctor myself. I find that it is ideally not helpful for the patient to go into the doctor and say, "Doc, will you help me with getting disability benefits?" Remember, the doctor is there to help the patient get better. And if the nurse or the doctor thinks Jim is just here to help me get a check, that doctor or that nurse is probably not going to help. So I discourage patients from asking the doctor or the nurse to help with a disability claim. Rather, I believe it's better if the nurse approaches the clinic or the doctor first and say, "I'm helping Jim. What do you think?" And the doctor will be very candid about it. If the doctor is supportive, then we can come up with a plan. And if the doctor or the nurse is not supportive, I go to the alternative. But it's very common for me to be able to develop a relationship with the physician or a nurse after a denial once the nurse or the doctor has all the facts and is provided more evidence. Lots of times the primary care doctor doesn't know that Jim has been treated for psychological problems or doesn't know that Jim has been in physical therapy. So once the doctor has all the evidence, the doctor or the nurse that you're seeking an opinion from is many times more helpful. This is a common tactic that I approach and use when a person comes to me after they've received a denial. It is not hopeless to appeal.
Roger, you mentioned there about the alternative, and I would love for you to elaborate on that. So, someone's listening to this, their doctor is a little unsupportive, let's say, for lack of a better term, or if they decline to fill out some of the necessary forms. What would you recommend that they do?
The first thing is make sure that you have all the medical records and that the Railroad Retirement Board has all the medical records. Let's assume the doctor is not going to help. At that point in time, my approach is to myself personally go through the medical records, personally identify the severe impairments, identify where the severe impairment is well supported by a test or a diagnosis or other medical evidence. I point out where the symptoms of fatigue, having to take a nap, I no longer drive, my daily activities are impaired, I need to take a nap. A non-doctor can perform the summary or a medical outline to the Railroad Retirement Board as well as a physician. It doesn't have the same weight as a physician, but if there's a properly supported opinion of bipolar disorder or degenerative disc disease, the Railroad Retirement Board is all too open to considering severe impairments becoming disabling conditions if they have all the evidence and it's given to them in an outline or summary form. It is not hopeless if the doctor doesn't want to cooperate.
Hmm.
If the primary care physician doesn't want to cooperate, maybe a therapist will be supportive, or maybe a nurse will be supportive. So you can look to other healthcare providers for help.
Roger, have you seen in your experience, have you seen differences between when someone gets a report from, let's say, a company doctor versus a report from being treated by their own primary care physician?
Yes, the company doctor is paid for by the employer, or the company doctor is paid by the insurance company. Of course, they're typically not going to be as supportive as the primary care physician. That's human nature. However, the company doctor may give a supportive opinion. So I look at all medical opinions, whether it's from the company doctor, an insurance company doctor, or a doctor that saw Jim several years ago on another claim. So it's not hopeless, but the company doctor, the insurance company doctor, they're paid for by the employer or the insurance company, and by human nature, they're not there to help the patient.
True. Roger, before I let you go, can you give the best piece of advice right now for a railroad worker that's listening to this? They want to make sure their doctor's documentation, it maximizes their chances to get approval. What's the best piece of advice you can leave them with right now?
Tell the truth and seek treatment. Do not get discouraged. Do not act like you're Superman anymore. If you have back pain, if your hands don't work, if you can't lift and carry like you used to, tell the truth. And make sure that you tell the truth to your doctor and when you submit your documents to the Railroad Retirement Board. Sometimes people think that they've got to hide something or they need to fabricate something. That's not going to work. Tell the truth.
Tell the truth in all walks of life. Thank you, Roger, for the time and insights. We truly appreciate it.
It's a privilege to help people get benefits that they've paid for when they no longer have good health. Thank you.
And thank you to everybody out there for listening to another episode of Disability Law for Railroad Workers. If you need help today making sure your doctor's report is strong enough for a disability claim, do me a favor and visit BurnettDriskill.com. Be sure to like, leave a comment, review, subscribe, share this episode with someone that needs to hear it. As always, I'm Mike Leon. We'll see everybody next time.
Thanks for watching. Be sure to hit that like and subscribe button and leave us a review in the comments.